In our nation's capital tonight, President Trump's so-called Big Beautiful Bill is heading back to the House after barely passing the Senate. Vice President J.D. Vance broke a 50-50 tie. The measure includes major cuts to Medicaid, also known as Sooner Care, here in Oklahoma.
And that has Oklahoma doctors voicing real worry. News 4's Tanner De Leon is here with the warning and how Oklahoma's senior U.S. Senator is addressing what he calls falsehoods about all this. Tanner?
Well, doctors say those in rural towns could be hit the hardest, but more than half the state is at some risk. And with how low Oklahoma health outcomes already are, a doctor I talked to fears those will only get worse if this bill becomes law.
I worry a lot. Oklahoma is already a vulnerable state, so we have some of the poorest health outcomes in the nation.
Oklahoma ranks near the bottom when it comes to health care access, quality care, and public health, something Dr. Dana Stone fears will only get worse if the so-called Big Beautiful Bill goes through. According to the nonpartisan Congressional Budget Office, proposed Medicaid cuts could strip 12 million Americans of health insurance. Nearly 1 in every 4 Oklahomans rely on Medicaid, also known as Sooner Care, which also pays for 52% of births in the state.
Over half of deliveries in Oklahoma are covered by Medicaid. Almost half of kids are covered by Medicaid. Seniors, people in nursing homes, people with disabilities, really vulnerable people that if they lose their health coverage will have difficulty accessing care and difficulty affording care.
After the bill passed the U.S. Senate Tuesday, Senator James Lankford's office shared a video to dispel what he calls falsehoods.
This absolutely does not cut off Medicaid funds. Let me tell you what it does. It adds a work requirement to Medicaid, the same kind of work requirement that Bill Clinton put in for the social safety net in 1996. Now, it's not for disabled children or pregnant moms. It's for able-bodied adults with no children.
But there are worries about possible impacts on rural hospitals.
I think the rural hospitals saw that some of that care that people came in that they couldn't pay for, now they got compensated for that, and that gave them the ability to stay open. There apparently a third of Oklahoma hospitals are vulnerable to closure, and they feel that at least 23 hospitals in Oklahoma could immediately be at risk of closing.
Senator Lankford says that won't be the case.
So here's some people say, oh my gosh, this is something right away that's going to close down hospitals. That's not true. We've also added in a $50 billion fund for rural hospitals to make sure our most vulnerable hospitals do have support there, because we believe that those are vulnerable hospitals, but they're essential hospitals all over the country, including in Oklahoma.
But Dr. Stone says she's already seen those in rural towns drive great distances for health care, and it will only increase.
We have people that come from western Oklahoma and kind of mid-central Oklahoma who drive, 2 hours routinely to come get care and deliver their babies because it's not available in their communities.
Now, you heard Senator Lankford say they've added $50 billion to support rural hospitals. But Dr. Stone says if patients lose coverage, there won't be enough people going to hospitals to keep them open.